Traumatic brain injuries are generally the result of sudden, violent blows to the head, and although commonly associated with football players, these types of injuries affect many other Americans. But now a football legend has lent his name and fame to a new study and research center aimed to score big gains in treatment. With this morning's Health Matters, we're pleased to be joined by Newsmax Deputy Health Editor Nick Tate, who is in our newsroom. We point out again, Nick is also the co-author of Da Vinci's Baby Boomer Survival Guide. Morning, Nick.
Morning, J.D. You know, I always loved Joe Namath when I was a kid growing up in Western New York in the 1970s, and the fact that he's now stepping up efforts to help NFL players like himself who've suffered repeated head injuries is giving us all another reason to pay attention to what he's up to these days. We recently caught up with Namath and the doctors he's working with on a new treatment for traumatic brain injuries that could truly be a game changer, and not only for former football players. Joe Namath has been known for many things over the years. His dazzling performance on the football field earned him a spot in the NFL Hall of Fame, and his larger-than-life persona off the field earned him the nickname Broadway Joe. But now, Namath is working to make his name synonymous with something else entirely, finding a cure for NFL players suffering from traumatic brain injuries sustained on the field. Here, in this small medical complex in South Florida, the former New York Jets quarterback has founded the Joe Namath Neurological Research Center, and Dr. Lee Fox is quietly going about the business bringing new hope and help to former players and others suffering from brain injuries. Among the patients, Joe Namath himself.
After seeing some of my teammates, a couple of them literally deteriorate and pass on, and while during that period, I began to analyze and monitor myself, so to speak. How is my mind working these days? I walk in one room and I say, well, why'd I come in here?
So Namath approached Dr. Fox, who happens to be an old golfing buddy, to see if a new approach called Hyperbaric Oxygen therapy could improve his condition. Dr. Fox put Namath through a battery of tests to gauge his working memory and thinking ability, as well as so-called SPECT brain scans. He then underwent dozens of treatments over nearly 7 months. But after even the first few treatments, Namath says he could feel his mind becoming sharper and his memory starting to improve. And today, at age 71, he says he feels better than he has in years. What's even more remarkable is that the latest scans of Namath's brain reveal notable improvements in blood flow and activity in key areas tied to memory and thinking ability. Brain regions that had initially appeared dark in the scans began to light up after his therapy, suggesting brain cells that had gone dormant over the years were suddenly and remarkably coming back to life.
He went through 120 treatments, over 200 plus days. I don't know exactly the number of days, but he went through the full 120 treatments, and he continued to improve the whole time. We put him through the testing again, the cognitive testing, the SPECT scan, and all of the improvements that he had over the previous year were all maintained. His SPECT scan remained normal, his cognitive exam remained normal, and to this day he continues to feel great.
Namath himself was able to observe the improvements in his own brain scans as he continued to receive therapy, even as he could feel his thinking become clearer and more focused by the day.
I was able to literally see the change take place in my brain. Each one showed a marked improvement to where our most recent one is wonderful.
While the findings are preliminary, they do represent a promising new approach to treating traumatic brain injuries, and not only in former football players, but also others who've suffered serious blows to the head, including military veterans and accident victims. Questions about the long-term effects of concussions have become a major focus of the NFL and scientific researchers as well in recent years. The NFL has changed the rules of the game, outlawing certain helmet-to-helmet tackling techniques that were once common but put players at risk. And league officials recently reported that as many as a third of NFL players can be expected to have brain injuries. At the same time, a growing number of studies has tied head injuries to an increased risk for suicide and a variety of mental health problems, including depression and Alzheimer's, as well as a propensity to commit violent acts. Several high-profile cases have brought the issue to national attention in recent years, including the recent Ray Rice domestic violence affair and the tragic suicide of former NFL linebacker Junior Seau in 2012. An autopsy revealed the 43-year-old player suffered from a newly identified condition known as chronic traumatic encephalopathy, or CTE. It's a progressive degenerative brain disease found in athletes and others with a history of repetitive brain trauma.
Although he clearly had a history of head trauma playing in the NFL, Joe wasn't really suffering from chronic brain injury, but he had some very mild symptoms, and he's very cognizant of his health. He works out every day. He's a very healthy individual, and he started to notice some of the very earliest signs of cognitive impairment. Certainly nothing severe, but enough to kind of say, maybe I should check this out. And when we evaluated him, we thought we could actually help him even with his mild symptoms. And so he was our first patient to go through our trial.
Hyperbaric oxygen therapy is an alternative treatment that has only recently become the focus of research as a promising new way to treat brain injuries. Such injuries can starve brain cells of vital oxygen, causing them to go dormant or even die. So as part of hyperbaric therapy, doctors flood the brain with high volumes of medical-grade oxygen to awaken dormant brain cells, reduce the extent of brain damage, and speed recovery and rehabilitation. Armed with the impressive and positive early results of the therapy's effectiveness, Namath has lent his name to the Jupiter Center and is now working to help raise the funds needed to conduct a wider Food and Drug Administration-approved clinical trial to evaluate whether it can truly reverse the effects of brain injury. For his part, Namath says he is not only hopeful that the center's work will lead to improvements for potentially millions of Americans with traumatic brain injuries, but he's also grateful for the benefits he has seen in his own life. You know, JD, it's amazing. They have lined up dozens of folks to participate in the next phase of this study, and now they're just waiting for the funding. So the hope is that we could see some answers in the next year or two. And, you know, for Namath, he recognizes that lending his name to this effort can really have a profound impact on raising its visibility and the prospects for success.
Nick Tate, a great story about a great athlete and a greater man. I've had occasion to meet Joe Namath in a couple of different venues, once as a sportscaster and then as a member of Congress. Always very, very gracious, and we appreciate this update on how he's helping so many of his teammates and other people with this traumatic brain injury and this kind of therapy. Thanks for the report.
Thank you.
And wherever you're watching, a reminder that you too can learn how to survive the baby boomer financial crisis with the newly released book, Da Vinci's Baby Boomer Survival Guide. Find out more at babyboomer711.com.